Hello, today I'd like to talk with you about suicide. This is one of the most important topics you'll read about during our time together, perhaps the most important topic, because knowledge about suicide may save your own life or someone else's life one day. As you may be aware, the incidence of suicide in the general population is around 12 per 100,000. In one group in particular, the rate of suicide has increased considerably in recent years. Some estimates are that for teenagers, the suicide rate has tripled in the past 30 years. Of course, suicide can occur anytime throughout the lifespan. It even occurs in childhood. And it definitely occurs later in life as well. If you've ever lost anyone to suicide, or even had somebody that you care about attempt suicide, you have a sense of how tragic such a loss is for those left behind. It can be hard for us to get inside the mind of a suicidal person and understand what they are experiencing. But one suicide researcher put it this way. He said that the four-letter word in suicide is only, meaning that when a person is suicidal, they see ending their life as their only option. Of course, many more people attempt suicide than actually succeed at it. But when someone is thinking about suicide, we always need to take it seriously. In the case of teenagers, where the suicide rate has been so disturbingly on the rise, efforts have been made to identify factors that might be associated with that increase in suicide rate in recent years. Various factors have been looked at, including how stressful the lives of teenagers are these days, the use of alcohol and other drugs, the presence of trauma in the teenager's life, and of course, depression, because suicide and depression oftentimes go hand in hand. When we move into adulthood, the highest risk group there for suicide is elderly white males, especially over the age of 85. What to do if we're concerned that somebody might be suicidal? Well, sadly, if someone wants to kill themselves badly enough, they may eventually figure out a way to do it. What we can do is hopefully help prevent that from happening in the present by taking whatever steps are necessary to keep the person safe. If someone is lying in the floor bleeding, or they've just had a heart attack, we know it's a life-threatening situation. But someone can be suicidal, and those around that person have no idea what is going on if the person is not willing to talk about it. Sometimes their behavior may suggest a change. with such things as preoccupation with death, becoming more depressed and withdrawn, giving away prized possessions, and making comments like, everybody would be better off if I weren't around anymore. But at other times, we might not see those signals to really know if someone is suicidal. So one of the most important things that a suicidal person can do to stay safe is to talk about it. And one of the most important things we can do is to ask about it. There is a myth that if you ask somebody about suicide, you're giving them the idea and they'll be more likely to do it. In fact, the opposite is more likely to be the case. By getting it out there in the open and talking about it, it may be the first critical step towards getting help and staying safe. If someone has an effective way of killing themselves that's readily available to them, then of course they would be in a high risk situation. But even in the absence of that, we still need to take it seriously. Because, for example, if a teenager is threatening suicide to get his or her own way, that's really not normal behavior. And something like that would need to be taken seriously. One issue that sometimes comes up is whether or not to tell another person if someone reveals to you that they are suicidal. The answer to the question, should I tell someone who may be in a position to do something about it to help keep that person safe? The answer to that question is definitely yes. We might be concerned that the suicidal person will feel like we betrayed their trust if we tell somebody in a position to perhaps do something about it if they're suicidal. But people can get over being angry. They cannot get over being dead. So getting it out there in the open, asking about it, talking about it, being a good listener, being supportive, and taking definitive action to help keep the person safe. These are all important steps that we can take. And of course, if we are the ones who are having suicidal thoughts, we really need to talk about it with other people and get help for ourselves. Because when we're in a suicidal state of mind, we're not thinking rationally. Usually we're in a hopeless place, and that can be a scary place to be. So ask about it, listen, talk about it, take definitive steps to help keep the person safe. That is how we can help prevent suicide in ourselves and others. Thank you, and I look forward to talking with you again soon.